Hi, Rachel Wall with Inspired Hygiene here. So I'd love to share a story with you about a disconnect between what the healthcare provider is sharing with the patient and the patient's perceived value of that. So recently I was teaching a large group of hygienists a course we call life-saving screenings, where we really remind and refine the hygienists methods for doing particular life-saving screenings like oral cancer screening, airway screening, blood pressure screening. All right, then fast forward just a couple days after I'm teaching this course and I'm sitting at dinner with some friends, and the topic of their dentist comes up. They've had a change. A new dentist came into the practice, and their perception was they were being upsold into a sleep apnea device. And so I'm thinking about the contrast between us as dental care, healthcare providers. There's a huge value in protecting somebody against sleep apnea, right? This is a life or death situation. And so I'm wondering what the disconnect is here. And I want to offer an idea, something to maybe think about as you are presenting these screenings or you're having these conversations and asking these questions to patients. Are we looking at this really as a protocol or like something that is on our list of things that we must do with these patients, right? And there's a long list of things that we think are valuable to perform as far as screenings go, but how are we making that personal to the patient? And sometimes it's easier than others, right? If they've put on their medical history that, they have high blood pressure or they have acid reflux or things like that, we know that those can be symptoms of sleep apnea. And, or let's say they come in and they're like, oh my gosh, I just didn't sleep well last night, or I'm drowsy, or I'm always tired, or whatever it is. There's an open door for us to ask questions to make it personal to that patient. So maybe think about that. Like, instead of just going through our checklist of things to do and asking these questions that seem odd to patients, how can we really connect the dots for them so that they see that our screenings really are an effort to help them prevent disease, um, increase their health, and really that we can be on the front lines of these life-saving screenings. So I'd love to get your input on this and where you feel like that disconnect is with patients and providers.